A preventable and yet neglected disease, tagged the silent killer because it often has no noticeable symptoms, even while causing damage to vital organs and increasing the risk of complications. People tend to live with this disease for years, leading to life-threatening complications if left untreated. Hypertension, the silent killer. That is what we'll be talking about today. So stick around and let's go right into the topic. Hi fam, welcome and welcome back to my channel. If you are seeing my face for the first time, I am Dr. Olsa, and today, as we have seen, we are going to be talking about hypertension. If you have not subscribed, please subscribe to this channel so that you don't miss out on other health tips like this, and give this video a thumbs up because it's definitely going to be informative, and leave a comment in the comment section so that I can reach more people and help them know about the silent killer. Okay, so let's go right into the topic. So, what is hypertension? Hypertension is a state whereby the force of blood pushing against your vessels becomes too high, and normally blood flows through our vessels to supply oxygen and nutrients all over our bodies. So what happens in hypertension is that the force by which the blood flows through these vessels becomes too high, and that puts strain on the vessels and leads to various complications. You must have heard of something called systolic and diastolic blood pressure, and if you have checked your blood pressure before, especially with the automatic sphygmomanometer, you must have seen that there is a value up and there's a value down. So I'm going to explain that to you. The systolic blood pressure is the value above, and that is the pressure that is recorded when your heart contracts. Your heart contracts to push out blood to reach other parts of your body. So when the heart contracts and pushes out that blood, that gets the systolic reading, which is the value on top. And then the value below is the diastolic blood pressure, and this is the blood pressure recorded when your heart relaxes to receive blood, because the heart gives out blood and also receives it and also gives it out again. So when it relaxes to receive this blood, that is the diastolic blood pressure, and that is the value below. And so that is why you see that whenever we talk about blood pressure reading, we mention two values, which is the systolic over the diastolic in millimeters of mercury. That is the unit we use for blood pressure. So that brings us to the range of blood pressure. According to the 2017 American College of Cardiology guidelines, we have four categories where we can fix blood pressure. We have the normal blood pressure, which is values below 120 over 80 millimeters of mercury, and then we have elevated blood pressure, which is systolic blood pressure of 120 to 129 millimeters of mercury, and diastolic blood pressure of less than 80 millimeters of mercury. That's what we tag as elevated blood pressure. For stage 1 hypertension, it is systolic blood pressure of 130 to 139 millimeters of mercury, and or diastolic blood pressure of 80 to 90 millimeters of mercury. And for stage 2 hypertension, it is systolic blood pressure of 140 to 180 millimeters of mercury, and or diastolic blood pressure of 90 to 120 millimeters of mercury. And that is the four classes of blood pressure according to the guidelines. And then we have something called hypertensive crisis, which is divided into two, which is hypertensive emergencies and hypertensive urgencies. Hypertensive emergency is when there is elevated blood pressure of greater than 180 over 120 millimeters of mercury, and the presence of impending or progressive end organ damage. While for hypertensive urgencies, the blood pressure is still elevated, and that is 180 over 120 millimeters of mercury, but there is no end organ damage. That is the difference between emergency and urgency. What you have to take from this one now is that you are to check your blood pressure regularly, and if peradventure you ever notice elevated blood pressure, especially when it is as high as 180 over 120 millimeters of mercury, you are to run to the hospital. I'm not saying you should wait till it gets to that value. You have to check it whenever it's elevated above normal for you. You have to see your doctor. But if, for instance, you have not even been checking, and the first time you are checking, you are seeing 180, 120 millimeters of mercury, you are to run. Like, as you are seeing it, you are to run to the hospital as soon as possible. You are not to stay one more minute in your house. So anytime you notice that. For the other elevated ones, you can say, okay, I'll go tomorrow. I'll go when I have time. When I have time from work, I'll go when I have a break. But for this one, if you mistakenly notice 180, 120, there is no time to create time. You have to go ASAP. Okay, we have two types of hypertension, which is the primary or essential hypertension and the secondary hypertension. Primary hypertension or essential hypertension is hypertension without any identifiable secondary cause. So there is no problem causing the hypertension, it just occurs on its own. And it is primary hypertension that occurs in 90 to 95% of hypertension cases. While for the secondary hypertension, it is hypertension that is secondary to another condition. That is hypertension that is due to something else. That means something else that is happening in the body is what is causing hypertension, and that happens in about 5 to 10% of hypertension cases. Now that we are clear with that, we are going to talk about why hypertension is dangerous. So the silent killer, why would you think that they will name something silent killer? It is because it can be there for years, for a long time, and people will not feel any symptoms. You know, in most of the health talks that I have given, I have talked about symptoms and signs, but in hypertension, there is really nothing to talk about as symptom and sign. It can just be there. You won't know. You feel very fine. You feel very okay, and you feel very normal. So people can even be telling you that check blood pressure, because doctor has been saying check blood pressure. You say I'm fine now, I'm doing my normal everyday activity, there's no need for this blood pressure. That's how hypertension can be. It gives you no sign, it gives you no hint that I am present. It is just there on its own, relaxing and enjoying. That is why it is very, very dangerous, because there is no sign, you can't see, you don't know. Over time, if it is not controlled, if it is left untreated, it can lead to many complications. So many things can just go wrong. It can lead to heart disease, stroke, kidney damage, eye damage. And that is why this is such a big deal, because it is very life-threatening. What are the risk factors for hypertension? What are the things that can predispose an individual to hypertension? First, we have genetics or family history. If you have somebody in your family that has hypertension, especially a close relative like your father, your mother, your sister, your brother, you have a higher risk of developing hypertension. And then we have age. The risk for high blood pressure increases with increasing age, but once again, that is changing, because younger people are coming down with high blood pressure. Like very, very young people are coming down with hypertension, and that is probably due to our lifestyle habits, our sedentary life and consumption of processed foods and all of that. But it used to be known that the risk of hypertension increases with increasing age, but right now even young people are coming down with hypertension. So there is no escape for anybody watching this video. You are not too young to check your blood pressure. So a diet high in salt, processed foods, low in fruits and vegetables is a risk factor for hypertension. Lack of exercise, being inactive is also a risk factor, as well as being overweight is a risk factor for hypertension. And we have smoking and alcohol consumption as well. And stress, long-term stress or chronic stress is also a risk factor for hypertension. So now we have talked about the risk factors. How then can we prevent and manage this disease, you may ask? That is why I'm here. Let's talk about that. There's something called lifestyle modification, and this includes dietary modifications, dietary adjustments that will limit salt intake. A way to reduce your salt intake is by avoiding salt in your plains like rice and yam. If you are boiling rice, since there is going to be salt in your stew, there's no need to add salt to your white rice, and then there's no need to add salt to your yam that you are boiling if you are eating it with something else, because that something else already has salt. If you are frying plantain, you can remove salt. So small things like this can help you cut down your salt intake, reduce your consumption of processed foods and packaged foods generally, because they are high in sodium, so you have to reduce them as much as possible. You have to eat whole foods, fruits, vegetables. Just eat as healthy as possible. The closer the food is to nature, the better it is for you. Reduce fatty foods, fried foods especially. If you can find alternative cooking methods to frying, please do. Drink water more frequently, more regularly. It's good for your health. Yeah, it's good for you. Cut down on your caffeine intake. Avoid excessive intake of caffeine. It can also elevate your blood pressure. Another lifestyle modification is to exercise regularly. Don't be tired of my exercise talks. Don't be tired. Exercise regularly, for real. Aim for a minimum of 30 minutes of exercise in most days of the week, like 5 times a week, 4 times a week, or in a week a minimum of 150 minutes of moderate intensity exercises spread apart. So just try to move every day of the week, or like 5 times a week. Move. You're not a tree. Don't stay in one place. Move. Limit your smoking and alcohol consumption, but I like to say cut it off. Quit it totally. It's really of no benefit, so just cut it off. Quit it. Stop entirely. Don't smoke, don't drink. It will help you. And then maintain a healthy weight. You have to know your BMI, your body mass index, which is calculated as your weight in kg over your height in meters squared. So how do you get your BMI? Because that's what we used to classify people's weight as being underweight, normal weight, overweight, and obese. You measure your weight in kilograms and measure your height in meters. What you are going to do is that you are going to square your height, which is in meters, and then you take your weight in kilogram and divide it by your height that you have squared. So that's why the unit is kilogram per meter squared. So you divide your weight in kilogram by your height in meter squared. That gives you your body mass index. Stress management. Try to avoid stress as much as you can. Stress, especially chronic stress, is not good for your health. It's not good for your body. It's going to elevate your blood pressure. Cut out stress as much as you can. I know that it's not easy because there's a lot going on today with everything, but just try to find peace, because there is really nothing that worry can change. So try to make peace with whatever you are going through so that you can be healthier, because chronic stress is not good for you. It causes a lot of harm and damage to your body. Regular monitoring. Check your blood pressure regularly. You can buy a blood pressure kit at home. That's a sphygmomanometer. You can buy it at home to check your blood pressure, or you can walk into any pharmacy and check your blood pressure. You can go to the hospital to check your blood pressure, but it is just easier to just get one. Check pharmacies around you and get one for yourself. It's a must-have for every household. You have to check your blood pressure regularly. You are not too young. Don't say, okay, I'm 20, I'm 25. Young people are coming down with this thing. Please check your blood pressure. Take this very, very seriously. It's a serious matter. So treatment options. What are the treatment options available if you have checked and your blood pressure is elevated? Like I would always say, if you have checked and your blood pressure is elevated, you have to go to the hospital. You have to go to your doctor. You are not to self-medicate. You are not to walk into the pharmacy and say, oh, my blood pressure is elevated, give me a medication. No. You have to go to the hospital where the doctor will ask you questions, take history from you, examine you, and also do some investigation. So know which medication best suits you. I know that there are so many blood pressure medications, and maybe you have somebody in your house already has high blood pressure, so you may be tempted to say, okay, since you have high blood pressure and I also have to, why not give me your own? Let me start taking it the way your doctor told you. Don't ever try that. You are two different people. A doctor has to have taken a history from you, asked you questions to know your peculiarities as an individual, examined you, done some investigations on you before he can give you medications. So you cannot just take anybody's blood pressure medication because you feel like, okay, it's my husband or it's my sister and I can just take it. You can't do that. You can't walk into a pharmacy and get it. You have to see a doctor to prescribe it for you, because there are peculiarities that the doctor is going to see that will make the doctor give you a particular drug. That is why you cannot take anybody's one. So now that we've settled it, that we have to see a doctor, I'll now mention the treatment options available. These things I am saying are not for you to make decisions on your own. They are for you to be aware so that you can have a knowledge about these things and to help you make better decisions. Okay, before I talk about the treatment options, I forgot to mention earlier that this blood pressure reading is gotten from a minimum of 2 blood pressure readings on 2 different hospital visits. So the average of a minimum of 2 blood pressure readings on a minimum of 2 hospital visits is what gives the value that is used to make the diagnosis of hypertension. So you have to have taken like 2 readings minimum and gone for 2 hospital visits for you to get the average of the value and say that, okay, this is now the blood pressure. Well, we will now classify it as whether it's elevated or not. So I forgot to mention that, so I just have to put that out. So now we are back to the treatment options available for hypertension. So the first one is lifestyle modification. We have talked about that. We've mentioned the ways that we can modify our lifestyle, so I'm not going to talk about that again. Secondly, we have medication. Sometimes the condition may be bigger than just lifestyle modifications. It may now need medication, so the doctor will prescribe medications for you to help you control your blood pressure. Then we have routine follow-up or checkup. You have to keep going to the doctor for checkups so your blood pressure can be reviewed and your medications reviewed to see if you need to make adjustments to the medications that you're already taking. So follow-up is very important in the management of blood pressure. You are not to say, okay, the doctor has told me that I have high blood pressure, he has given me medication, so I'll just be buying the medication anytime it finishes. I'll just be buying it, and you will not go back to the doctor. How do you know if it is well controlled? How do you know if all your vital organs are safe from the harm and damage that it can cause? So it is important that you go to the doctor for follow-up, for checkups, to know if this hypertension is under control, because it has to be under control. If it goes out of control, it just goes into something that is very dangerous. So remember that medications work best when prescribed by a doctor. I'm seriously against self-medication. That's why I always emphasize on the need for you to visit your doctor whenever you notice any of these things. These videos are for awareness purposes and not to replace your doctor's advice or your doctor's visit, okay? So before we go today, we are going to bust some myths about hypertension, some common misconceptions that I'm going to clear right now about hypertension. The first one is only old people can get hypertension. That is not true. I mentioned before that young people are coming down with this disease. It is no longer for old people. It's no longer an old people disease. Young people, like very young people, are coming down with it. So this is not something that you should take like a joke. That is why you need to share this video to somebody out there, your loved one, your family, your friend, to let them know about this silent killer. The second one is, if I feel fine, then my blood pressure must be fine. That is wrong, because when we introduced this topic, we talked about how this thing can be there for a long time, even for years, and you have no symptom. You can see so far that we do not do the normal or the usual signs and symptoms. Like, okay, if you see this one, like for diabetes, I'll say, okay, if you are urinating, if you are drinking water too much, if you are hungry. No. There's nothing like that here. It will just be there, so you can feel fine and not be fine. That is why you have to actually check. Third myth is that once I start taking medication, I can stop once my blood pressure is normal. That is wrong, because it is a chronic medical condition. Chronic meaning long term. So it is not wise for you to stop your medication without your doctor's advice. You have to always speak with your doctor before making any decision. This is not like a short-term disease or malaria that you're fine. It is long-term, it is chronic. So even if your blood pressure is normal, you cannot just stop your medication. Am I communicating? I know you must have gotten the memo so far, but I will still say it again. My advice to you is to check your blood pressure today. You can even pause this video and go and bring out your sphygmomanometer, your blood pressure machine, and check it now before you continue watching. Or if you don't have it, as soon as you stop watching this video, you can go out and get it. If it is too late, you can get it tomorrow, but the most important thing is that you are checking. And if you can't get it, that's also fine. Go to a pharmacy close to you and check it. Please don't play with this thing. Check your blood pressure. So let's summarize all we've done so far. We have talked about hypertension. We've said that it is when the force of blood through the vessels becomes too high, and it has the propensity to cause a lot of damage to your vital organs, and even lead to severe life-threatening complications. So we've talked about lifestyle changes and how these can greatly help us in the fight against hypertension, the dietary changes, the weight management, the exercises, and also quitting smoking and alcohol consumption. If you have been diagnosed, please follow your doctor's advice, follow your doctor's prescription. Do not self-medicate. We have already cleared that. So thank you so much for staying till this time. Thank you for watching. Thank you for taking your health seriously, because if you stay till this time, it means that you take your health seriously, to want to know how you can preserve your health. If you have not subscribed, why not subscribe so that you can continue to see more health content like this, and hit the notification bell so that you'll be the first to get notified whenever I post new videos. I know that you have found this very informative, very insightful. Why not give it a thumbs up and leave a comment so that it can reach more people that need to see this, and you can also share to your family and your friends so that they can hear about this and know how to fight against hypertension, the silent killer. Thank you so much for watching. Stay well, stay healthy. I'll see you in my next one. Bye for now.